Dr. Tyler Evans from Arete Chiropractic, and today we are coming at you live with the research moment. The topic today is constipation. So, it's kind of an awkward topic, but it's something that actually quite a few children go through in their life, and a lot of parents deal with on a regular basis. And so, we just want to address this and actually on a larger scale, that chiropractic is very safe for kids. It's gentle. It's very effective. And this topic here is one that is actually what most, I think it's a high percentage of children that see chiropractors or see physicians in general are coming in for constipation issues. So, it's a widespread thing. And so the title of this paper is The Successful Chiropractic Care of Pediatric Patients with Chronic Constipation, a case series and selective review of the literature by a guy by the name of Joel Alcantara, very well-published doc within the pediatric chiropractic profession. So there are 3 cases in this paper. The first one was a 20-month-old, complained of constipation since birth. Well, he didn't, but his parents did. And he was going to the bathroom every 3 to 4 days, described his feces as hard and large enough to occasionally cause bleeding, which was painful, obviously. And so there's this cycle that happens when children get constipated. It becomes painful, so they stop. They stop the feces and stop themselves from going to the bathroom, and it becomes a cycle. And so how do you break that cycle? Well, there's many ways. They use cod liver oil, they use lance oil or mineral oil, and there's some medications, laxatives that are used. And so if we can avoid doing that and correcting spinal tension and spinal misalignment, so that the child has the ability to heal and take care of the problem on their own, that's a lot better solution, right? So anyways, this 20-month-old complained of constipation since birth, was going to the bathroom every 3 to 4 days. Under care, came in, got under care. It resulted in an immediate response, and so he was immediately going to the bathroom every 1 to 2 days, but it was still painful. So they continued care, and for I think it was a few weeks, the mom noticed that the painful situation was getting better and better, and there was less pain. And then finally, after a few months, 2 months of care, the infant was experiencing daily bowel movements that were painless. So it did take a month of care, but after that, he was good to go. So there's sometimes a problem takes more than just one visit, and you won't see results maybe immediately, but over the course of days, weeks, and then maybe a month or two, see good changes. So then in this second case report, a 7-month-old female, constipation since the age of constipation since the age of 2 months, was having bowel movements every 3 days. And then after the second visit, the patient's mother reported that she was having bowel movements every 1 to 2 days. So that cleared up fairly quickly for that child. And then the last case report was a 21-month-old that was a female child that had very painful and traumatic going to the bathroom episodes. And so on occasion, these were accompanied by rectal bleeding. And then after 10 days of care, patient's mother reported they were having daily bowel movements. And so Again, there's 3 cases right there of constipation being relieved with chiropractic care. Very effective, gentle. I think there's been some in the news. There have been some reports of chiropractors and kids and how it might be contraindicated. Well, the truth is chiropractic is very safe and very effective for children and can help with a whole host of problems like colic, constipation, enuresis or wetting the bed, acute otitis media like chronic ear infections, fevers, all kinds of things. So, if you know of a child that's suffering from any one of those issues, but specifically constipation in this paper here, chiropractic is a great solution. So if you have any questions, give us a call at Arete Chiropractic in Portsmouth, New Hampshire. This is Dr. Tyler Evans here. Have a great day.